I'm so excited. Okay, so I'm ready when you're ready. On your mark, get set, go.
Hello, I'm Aaliyah, and I'm presenting diabetes. The reason I chose diabetes was because my mom and my sister both have type 1 diabetes, and I thought it was interesting to present about. The word diabetes is a shortened version of the word diabetes mellitus. Diabetes is a Greek word meaning to pass through or siphon, and the word mellitus means honey or sweet. The phrase comes from, they used to drink the pee of the patients with diabetes, and it comes from the days. There are three main types of diabetes: type 1, type 2, and gestational diabetes, which is diabetes from pregnant women. Diabetes occurs when the pancreas doesn't produce enough insulin or the body cannot use the insulin it does produce. Type 1 diabetes, the pancreatic cells that produce insulin are destroyed by the body's immune system, causing very little or no insulin being produced at all. That allows sugar to build up into the bloodstream. But in type 2 diabetes, insulin is produced, the body just can't use it. Cell communication is the communication between cells that ensures all cells are properly functioning and carrying out their individual functions. Cell communication usually takes place in the signal transduction pathway. Two types of cell communication include local distance and long distance signaling. Local distance signaling is when a cell binds to nearby cells, and then long distance signaling is when it travels through either pathways or like the bloodstreams to get to the next, to give the next signal. Diabetes is a cell communication disease because the pancreas normally releases a signal called insulin, which tells your liver, muscles, and fat cells to store the sugar from the bloodstream. Diabetes occurs when the pancreas does not produce enough insulin or the body cannot use it effectively. In type 1 diabetes, the pancreatic cells that produce insulin are destroyed and no insulin is produced. This is a diagram of type 1 diabetes. As you can see, well, this is the pancreas right here. It takes the glucose or the sugar produced by the stomach, and it should produce insulin. And that's what these little blue dots are, the insulin that are supposed to gather all of this. But as you can see, there's not nearly enough insulin to get all the sugar. And this is type 2 diabetes. This is the insulin the body does produce, but it doesn't do anything. It just travels through the bloodstream. So things like pills are used for type 2 diabetes, and type 1 diabetes, they're given insulin. The signal transduction pathway consists of 3 stages. The first is reception, which is when the signal binds to the molecule. The signal molecule binds to the receptor. The second stage is transduction, where the chemical signal creates a series of enzyme activations. The third is response, which is in cellular responses. The breakdown for diabetes occurs in the first stage, which is reception, because the insulin signal is never received. And this is another diagram. When there's no insulin, nothing happens. But here, this would be type 1 diabetes. The insulin is there, it turns this on, but it doesn't travel to the next place. And so it never ends up in the pancreas. This is also type 1. And then here we have like type 2. It goes, but it never makes it to the end. The insulin is there, it just doesn't work. And then this would be a normal person. The insulin travels through the bloodstreams, and then it responds and breaks down the sugar. The cell pathways related to diabetes are the PI3K and the AMPK. The AMPK pathway acts as an energy sensor. It increases the uptake of sugar by influencing glucose transporters. When these pathways don't work properly, the body can either not produce insulin, or the insulin it produces never makes it to where it's supposed to go. This is because the pathways, which are critical for linking the insulin cell signal to its receptor, cannot properly carry out this information, and it causes a disruption. Normally, cells in the pancreas release a signal called insulin. The insulin tells your liver, muscles, and fat cells to store the sugar in the body for later use. In type 1 diabetes, the signal sends, the body sends the signal to the pancreas, telling it to produce insulin, but it's lost. This is because the T cells called CD4 plus and CD4 or CD8 destroy the receiver. The insulin produces beta cells. Consequently, the body is left producing no insulin. In type 2 diabetes, the pancreas produces insulin, but similar to a lock and key, it never unlocks. So your body would be like the lock and the insulin is the key, but it's the wrong key. So it goes in, but it doesn't do anything. So it never unlocks it. Next, I'm going to talk about pathogen and genetics. A pathogen is an organism that causes disease to its host, such as a germ or bacteria. A genetic disorder is specifically found in genes and may be passed down. Type 1 diabetes is a complex trait, meaning that mutations in several genes occur and contribute to the disease. The exact cause of most types of diabetes is unknown. In our case, it's sugar builds up in the bloodstream. However, recent studies have shown about 10 loci in the human genome that have been linked to the susceptibility of type 1 diabetes. One of these being a gene at the locus of IDDM2 on chromosome 11, and the combinations of various variations in the HLDQA1 gene and other HLA genes affect the risk of type 1 diabetes. These are all the genes that they have recently found that may affect diabetes. It's just not 100% sure. And over here, this is the gene that causes type 1 diabetes. It happens in 5 places. Inheritance and environmental factors. If an immediate family member has diabetes, you are more likely to get diabetes. And in most cases of type 1 diabetes, the risk factors would need to be inherited from both parents. So like my sister, she has diabetes, but my brother and I don't. So it's likely that my mom and my dad were carriers, and they pass it to her. A man with type 1 diabetes has a 1 in 17 chance of producing a child who has diabetes. And a woman with type 1 diabetes who has a child before 25 years old has a 1 in 25 chance. And a woman over 25 having a child brings the risk to 1 in 100. Both type 1 and type 2 diabetes may be caused by a combination of genetic or environmental factors. Those factors include pollution, water, soil, unhealthy diet, stress, lack of physical activity, vitamin D deficiency, and exposure to other viruses.
I love you.
Treatment for type 2 diabetes are pills and other injectable insulins and medications. Type 2 diabetes, there are many different pills that work in different ways. Some medications such as meglitinides and sulfonylureas work by causing the pancreas to make and produce more insulin. Another classification of medicine for type 2 diabetes is called DPP4 inhibitors. These work by limiting the liver's ability to release glucose and causing the release of insulin when the blood sugar is high. The most common medicine for type 2 diabetes is called metformin. It's just a pill you take daily. And that's a bigonide. Bigonides work by preventing the production of sugar in the liver, improving the cell's sensitivity towards insulin. So it takes the insulin the body does produce, and it teaches the body how to use it. Treatment for type 1 diabetes include injectable insulin that works by stopping the liver from producing sugar and helping the sugar move into the tissues, out of the blood. And that's where it's used to make energy. Insulin is a protein made up of 2 chains, one being the A chain, which consists of 21 amino acids, and the B chain, which consists of 30 amino acids. They're all linked by sulfur atoms. Insulin stops the liver from producing sugar by decreasing gluconeogenesis and promoting glycogen synthesis. Gluconeogenesis is a process which takes place in the liver, where the liver turns non-sugar compounds such as proteins, lactates, and glycerol into sugar that the body uses as fuel. Insulin decreases this to slow down the intake of glucose into the bloodstream, and glycogen synthesis helps with maintaining blood glucose levels that are required to sustain the needs of an organism. The hyperglycemia, or high blood sugar, is the presence of larger doses of insulin and and causes excess production and storage of sugar in the liver. This is a Dexcom. This is it's kind of new. It's been around for a while, but it used to have wires and it would just be connected to your pocket. But now they have wireless ones. You put these on for type 1 diabetes. You put this on, and it gives you insulin throughout the day. It monitors your blood glucose levels for you, and it just pumps insulin to the body throughout the day. Symptoms of diabetes include often urination, thirst, weight loss, blurry vision, numb or tingling hands or feet, fatigue, dry skin, sores that heal slowly, and they're often infectious. 37.3 million Americans, which is about 1 in 10, have diabetes, and about 1 in 5 people with diabetes don't know they have it. 96 million American adults, which is about 1 in 3, have prediabetes, which is, that means you show high glucose levels, but they're not high enough to be considered a diabetic yet. But if you continue eating certain things, you'll end up becoming diabetic. And 8.5 million people are undiagnosed. This is if both the mother and the father carry diabetes. This is the percentage of the children that would be affected. So 25% would be affected, and 50% would be carriers, and then another 25% will go unaffected. But here, if the father has diabetes, 50% of the kids will have diabetes, and the other 50% won't. The cost of insulin without insurance is about $357 for one 10 milliliter vial. This is a 3 milliliter vial, and these come in packs of 5. And we go through about 4 to 5 of these in about a month. So it gets really expensive. It's about, I added it up, it was like around $4,000 a year just on one. And this is a long-acting insulin. You take this one every day, and this is a fast-acting insulin. This is the one you take as you're eating. Either my sister takes this either in the morning or at night every day, and this one just in between meals. The cost of Novolog, which is this one, is around $314 for 10 milliliters. This is a 5 milliliter valve. It comes with 60 units. This one comes with 100. Insulin was created by Sir Frederick G. Banting, Charles H. Best, and J.J.R. MacLeod in 1921 at the University of Toronto. The three were awarded a U.S. patent on the insulin and later sold their patents to the University of Toronto for $1 because they said everyone should have access to insulin. And now the prices have skyrocketed. These are my sources.